Hello and welcome to the Trust Driven Podcast. Today is Trivia Day, where we strive to make medical communication research not just informational, but fun. I'm your host, Dr. Melanie Short. I'd like to introduce our guests who are playing trivia today. First, returning this week, I have Dr. Josh Satterley, a chiropractic expert from Las Vegas, Nevada. Maria Neidig, a registered nurse and patient advocate in Columbus, Georgia. Dr. Dwayne Golbeck, a chiropractor in Catoosa, Oklahoma. And Dr. Lauren Bystek, a chiropractor in Lake of the Hills, Illinois. Dwayne is our returning champion this week, so we'll see if he can hold up to that or if Maria's going to try to overtake him. All right. Your first question. The article title is Use of Mobile Phone Text Message Reminders in Healthcare Services, a Narrative Literature Review. It's by Katie Canisto, and it was published in the Journal of Medical Internet Research in 2014. Your question is, true or false? Text message reminders sent to patients improved patient adherence, lowered no-shows, and had a positive impact on healthcare. I'm giving you guys some easy ones this week. How many of you guys use text message reminders?
I do.
Okay, so everybody? How often are they? Is it like the day before, a week before? How often do they get a message?
I can't remember my exact settings, but I think it's the day before and then like an hour before. Something like that.
Okay, nice. How about yours, Dwayne?
It's similar, yeah.
Mm-hmm. Josh?
Yeah, like 24 hours and 2 hours, I find. Although if I'm reminding a doctor about a meeting, I find that it has to be like 24 hours, 2 hours, 1 hour, 15 minutes, 5 minutes, and then the meeting has already started. Please jump on.
Yeah, that we're still late.
Yeah.
Maria, do you do reminders for your meetings with patients?
They get an email when it is scheduled, and then they get it, I know, at least an hour before.
Okay.
Yeah.
All right, you guys ready for your answer? Let's see what everybody got. True or false? Okay, everybody picked true. And it is true, not surprisingly, but they had 60 studies met the criteria for the literature review. And they noted 77% had increased patient outcomes too. So not only were patients more likely to show up to their visits and things like that, but they actually got better. Their outcomes were better. So use those text message reminders.
Yep. You know what I saw the other day that I hadn't seen in a long time is those really simple postcards from a dentist. Melanie, you have an appointment on Thursday at this time. And it was a month in advance, but it looked like almost like typewriter action.
Nice.
Crazy.
Haven't seen one of these in a while.
I know. It's like, kids, come look at the what do they call that? Fossils.
All right, let's go to question 2. I think that one was pretty straightforward. Okay, question 2. The title of this article is Doctor-Patient Communication, a Review of the Literature. It is by L.M. Ong, and it was published in the Social Science and Medicine Journal in 1995. So we're rewinding a little bit here.
Yeah.
Your question is, during a patient encounter, who should be speaking more? So is it A, the healthcare provider, or B, the patient? So when you're having a discussion with a patient, I kind of use this both for an initial encounter or a regular, follow-up visit. Who do you think should be dominating the conversation?
Mel, in this study, do you know, was it primary care setting, surgical consults? Does it say what the type of healthcare was by chance?
I don't have a specific office.
Okay.
Because it was more than one setting. It was across, if that makes sense. It was a literature review. They didn't specify a specific. All right, and you have 2 seconds and time. Okay, so we got A or B. I got Josh got B, Maria B, Lauren B, and Dwayne B. All right, sounds like we have some good practitioners around here because yes, the answer was B. Yes, so we should be giving open-ended questions to our patients. And essentially, the more they're talking, the more information you're gathering. So having a yes-no thing would be difficult.
That's what I was wondering, because I was like, oh, it's simply there. Of course, it's the patient. Like everybody knows that, blah blah blah. But then I was like, you know what? Within healthcare, are there types of visits where actually the healthcare provider it would like patient instructions for the first time? So somebody has diabetes, like there's a ton of instruction about foot care, right? And so there's different aspects like that would cause the answer to be A, and trick us all. Yeah.
But also, there was a discussion with that patient to find out that they had diabetes and to talk. So there was discussion like before So I would say that the patient, even in that setting, probably still talked more upfront. But I think this article too was looking at like even from 95. So that hasn't changed, that we need to like, in order to get information from our patients, we need to let them speak.
Yeah.
I think a lot of times we have difficulty doing that.
Yeah. In 2025 would be who should be staring at their screen more, the healthcare provider or the patient?
Yes, unfortunately, that screen. Let's move on. Number 3 is kind of similar to this, so we can kind of expand on this discussion. So the title of this article is The Relationship Between Physician Humility, Physician-Patient Communication, and Patient Health. And it was written by Peter Ruberton and published in the Patient Education and Counseling Journal from 2016. So your question is, what is defined as, so this is a definition, unflinching self-awareness, empathetic openness to others, and a keen appreciation of and gratitude for the privilege of caring for sick persons. Your answers are A, humility, B, empathy, or C, rapport. So is this describing humility, empathy, or rapport? I know I gave you guys a wordy one.
Yeah.
But again, this one kind of builds on the last one where who should be talking more? Who's more important in a visit? Is the doctor more important or is the patient more important? All right, you guys ready? And this one's a newer study, 2016. All right, let's see what we got. See, Josh A and Maria A. Okay, and your answer will be A, humility.
See, I would have guessed empathy, but empathy is in the statement, and I was like, oh, is that a trick?
Same.
Yeah.
Well, humility is in the the name of the article. I gave it to you. But essentially, like sometimes I feel like as practitioners, we want to explain ourselves and we want to be, the most important person in the room but truly this definition was, being open and empathetic to listening to what the patient had to say instead of our ego being, let me teach you all the things or let me tell you all about all the great things I've done. So I think sometimes as practitioners, we do talk a lot and we think that we're, explaining something really well to the patient, but in reality, the patient should be the most important person in the room. Any other discussion on that? These are pretty straightforward today, huh?
Yeah.
All right. Yeah. Essentially, we should be listening and caring and not just spewing our knowledge at somebody. Okay. Question number 4. So audio-visual aid. Since we haven't really touched on much yet on the podcast, but the title of this article is The Use of Audiovisual Aids for Patient Education in the Interventional Radiology Ambulatory Setting, a literature review. This one was by Melissa Goad. It was published in the Journal of Radiology Nursing in 2018. So your question here.
So, never mind. I was going to ask, so go back before the question pops up, if you don't mind. Interventional radiology ambulatory setting, is that people getting radiation treatment for cancer typically? Does anybody know?
No, this was like, I believe just regular radiology. So like getting any sort of radiology, like in an office setting.
I think interventional is when it's like the treatment though.
Probably.
I
Yes,
think
you're right.
That's why I'm like,
Medicine type.
yeah, thank you. That's the word I was looking for. I'm trying to think of who is getting it,
Mm-hmm.
Okay.
Yeah, who your patient base is.
Yeah.
Your question here is, what have audiovisual aids used in healthcare done? So have they A, increased patient anxiety, B, increased patient compliance, or C, take up valuable office visit time? So does having an audiovisual aid, let it be either a poster that you're describing or a handout that you're going to give to somebody? Do these aids increase somebody's anxiety about what's going on? Do they help with compliance? Do they take up just time because you're explaining something, or are they useful?
I feel like it depends on the education of the patient and what they're going in for and how much they understand it to begin with. Like, what is their baseline? Because if they're not sure about it and it's something really obscure, then it could totally take them off the hinges. But if it's something that's a provider or the healthcare team, because it could be nurse, LPN, teaching them, a little bit about what they're going to be having before the doctor comes in. If they know the education themselves, as far as with the LPNs, the RNs might know a little bit more because they just see a little bit more. But I feel like if the patients know and have a good baseline, it helps them as far as with their compliance and what they're supposed to do.
Yeah, I definitely agree with that. You guys ready to reveal your answers?
Oh, yeah.
Okay, let's see what we got. Lauren's got B. Josh has C. Maria B also. All right, let's do a quick check here. It was B.
See, I said C because I said take up valuable office time, because it's like, whether I show you the visual aid or not, let's be honest, you're not going to do your rehab. Like, let's just face the music. So why are we even wasting our time doing this? But perhaps I'm a little jaded.
Be a little jaded. I completely understand that. Although I think it's very patient demographic specific. And this is all from personal experience too, because everybody has different demographic that they treat. In my last office, I had mostly like Medicare aged patients. And man, you give them an exercise and a sheet and they will come back to you with questions the next week. Like, they are on it. So that, I definitely see how it can help with patient compliance and questions like that. And then you get, not to, talk down, but yeah, sometimes you get somebody in their early 20s and 30s and they're just too busy. They're like, I'm going to do it here when I'm in the office with you, but I'm not, paper is going to go under the seat in my car when I get in there.
Yeah. Yep. I remember walking into a PT clinic and I saw an exercise sheet on the ground in the parking lot. Oh,
great.
That's definitely producing results.
Lauren, do you guys have diagrams or anything up in the office that you use?
Right now, I have nothing on my walls because I'm repainting,
Mhm.
but I would love to have some, and some, especially like, a nerve chart and stuff. And I think, like, to a certain degree, when you're trying to explain like what's going on with a patient in the office, I think it can increase compliance. But yeah, like the home exercises are really hit or miss, very hit or miss.
Yeah.
Well, and it's time consuming to like put one of those, like, what's the HEP2 site, all the physical therapy sites. It's time consuming to put those exercises together for specific patients, print them out, and to find it in the street or in the parking lot would be really discouraging.
Yeah. I think too, one area where I think it, all joking aside, is very useful is especially with when there's a language barrier, So like, I have a friend, he's an orthopedic surgeon. And so we live in Las Vegas and we get a lot of international patients that come here from other places. And so he says, like, he trained in Cleveland or somewhere in Ohio. And he said he never used his joint models as much as when it's like, if the person natively speaks Spanish or Chinese or whatever, and you hand them a knee model, like, how else are you going to explain a meniscus if you barely, you know what I mean? Like,
Yeah.
I went through 3 years of Spanish in high school and lived in SoCal, and I can order food. I can talk about a job. I cannot talk about a shape of a meniscus and the difference between a bucket handle tear and whatever. So I think a joint model is perfect, right?
Awesome. Yeah. I always liked models.
No.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
All right. You guys have one question left. And Lauren and Maria are killing it this week. We got 4 of 4. Josh, you're there. You're hanging in there.
Well, Dwayne gave me his extra point when he left. No, I can cruise to it.
We said that I took him out in the second round, so
Mike Tyson over here,
Maria's got to hold up her winning streak then
y'all
against.
better go home, right?
That's right. It's like there's only one RN on here, and you'll remember the name.
Yes. I gotta represent.
Yeah, exactly. All right, you guys, I love this study. So this one's interesting to me. Okay, so the title of this article is An Automated Text Messaging System. It's called Tonsil Text-to-Me to Improve Tonsillectomy Perioperative Experience. Exploratory Qualitative Usability and Feasibility Study. So this was by Nathan Farias in the Journal of Medical Internet Research from 2020. So just to give you a little bit about it, these were kids that were having tonsillectomies and their parents were signed up for like text message instructions. So I'll kind of tell you how often they were sent, like while we're working on the question. But so that's kind of your basis, is the parents are getting the messages, but it's about their kids. A series of 13 messages were sent to parents beginning 2 weeks prior to the child tonsillectomy and ending 1 week after. What were the results? So A, parents thought the texts were annoying. B, parents thought the text didn't provide enough information. Or C, parents found the text to be helpful and not overbearing.
13 texts, huh?
13 text messages. And so I'll tell you kind of the breakdown because I wrote it out here. They were sent instruction 14 days before, 3 days before, 1 day before. So 2 weeks, 3 days, 1 day. And then the morning of in the evening. The 1 day before was the morning and evening. So they got something in the morning, something in the evening. And then 2 texts the day after, 2 texts 2 days after, 1 3 days after, and then 2 5 days after, and then 1 the following week. So it was a lot of messages. So were the parents annoyed with the messages? Did they not provide enough information? Or were they helpful and not overbearing? All right, in your answer, you guys ready? Let's see, you can reveal your answers. Josh has C, Maria has C, Lauren has C. All right. They were helpful and not overbearing.
That was you being an overbearing parent?
Yeah. You do what you can, but then they wake up an hour early from their nap, but it's all good. Yes, and the kind of cool information that I didn't even think about, being one that had a tonsillectomy, I was 18. So I was the one that got like the information, not so much my mom.
See, I wonder too, I would love to see a study where 13 text messages sounds like a high number, but texts are always very short.
Mm-hmm.
So I'd be very interested if they'd sent 13 emails, would they have just gotten brushed aside, ignored, not being, and therefore not have the effect that text messages did?
Mm-hmm. Well, and even so, like if you think about it, so they got like 2 messages the day before. Well, before surgery, you have, X amount of hours before you can't eat, or take your ibuprofen in the morning the day before. You have to be whatever it is, medication wise. I know a lot of surgeries too, they give some sort of like antibiotic beforehand. So having those leading up to it, and then after, especially with a child that may not be able to say like, oh, this is happening, it kind of prompts it, like gave them questions to like ask the kid, like, is there bleeding, is there swelling, is there things like that. So I thought it to be really useful, and good to know that they also, like the study found it super useful to use text messages for information, going back to the audiovisual aid instead of just giving them a visual or a phone call, like an audio message or something, having both visual because they're reading it, but you can also say audio because it's words, instructions. So I thought that was great.
I'd love to know too, like if you asked even like the billing department in those, like something seemingly unrelated, like how are the parents to deal with? Just when people get more information, they just typically become a little bit easier to deal with,
Mm-hmm.
Yeah.
Well, I think doing this with parents was kind of important in the study too, because parents are they're gonna like do it to the fullest, right? So if their kid is having surgery, they're gonna be, want to make sure everything goes well so they don't have to deal with any sort of aftermath too.
Yeah.
But yeah,
But it's an interesting age too, because you're getting that like kind of late teen age. So it's not the worry about the 6-week-old that, like, oh my God, but like, you know what I mean? Like, you're pretty comfortable being a parent by the time your kid has a tonsillectomy.
yeah, usually, yeah, early teens or so. I had mine really late, which was weird, but anyway. But yeah, the conclusion on that was that it was a super cost-effective way to get patients like more information than they could have in the other avenue.
Yeah, I love it.
We have a tie today, so I have a tiebreaker. So Maria and Lauren, you guys both killed it. You got all of them right. We've never had a podcast get all of the questions right, so I need to make them harder. But your question is, in feet, how long was the Titanic?
Are you kidding me?
All right. In medical feet, how long was the Titanic? Like, this is a medical podcast, so.
Yeah.
I don't even know what a good guess is. Wow. Okay.
I don't either, Lauren. I feel like, isn't this a medical show? Am I wrong with that? Oh.
I know, but I had to do something. I couldn't just say, like, what's the medical term for the kneecap?
I'm gonna go 8,000 feet.
Oh my God.
Okay, 8,000 feet. Maria, what did you think?
Gosh.
This is entertaining.
Man, I didn't know that you could stump licensed professionals this easy, Throw out a number.
Titanic? I mean, I'm not someone who knows these like random facts.
We don't have any history buffs around here. Come on. All right, throw a number out there.
I'm thinking. Yeah, I'm thinking. I'll do 15.
1,500 or 15 feet?
No, wait. Lauren said 8.
Oh, 8,000 feet. So 15,000?
Yes.
Okay. Your answer is 883 feet. So, Maria, after a great comeback, Lauren has won.
Oh, snatched her out of your hands.
So, Maria, we may be seeing you next week for the redemption.
Oh, yeah, I'm coming back. You know it.
All right, Lauren, what organization would you like to send a donation?
You do that? Illinois Chiropractic Society?
Sure, Illinois Chiropractic Society. All right, I would like to thank our guests. We lost Dwayne midway, but I'm sure he'll join us again soon. So thank you very much for another entertaining episode, and thank you to our listeners for joining us on another learning journey. Come back and join us next week as we discuss more stimulating medical communication research.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.